Hi, Dr. Sachin Patel, founder and director of Aged Care GP. This is a video which is an update today, which is the 9th of July 2020, about the COVID situation. So, in March, we had the initial pandemic and a lot of change, and now we're in a different phase. So, what's changed? It's important that you have an understanding of what's changed. In March time and April, May, most of the cases were related to international travellers bringing COVID back to Australia. Now it's a little bit different, and we need to take this seriously. And how's it different? Well, now the situation is that it's mainly local transmission that we're seeing. So in the community, transmission without between people without really understanding where it's come from. So it looks like it's now spreading through the community, and that means in aged care facilities we are at risk of COVID entering, and probably a bit more risk than we were previously. So that's the first thing. The next thing that I want to share with you is what you can expect from Aged Care GP. Actually, just before I do that, I'd just like to congratulate you on we've done tremendously well as a country up until this point, and those of you that we work with in aged care, we know, have been working tremendously hard to minimise the risks and the impacts on your residents, and I want to congratulate you on that, and then also express that we're now entering a period of time where we need to be even more vigilant than we have been already. And I understand you may be feeling tired and fatigued with having had all this happen, but this is going to be an 18 to 24 month issue at least. And so we need to be prepared to pivot and change and move according to the prevailing circumstances. All right, so from an aged care GP point of view, there's probably three things you need to know. We are as committed as ever to minimise the risks to your residents, the patients we look after, your facilities and your teams, and our own team as well. And so everything we're doing is in the name of risk reduction. So you will see our team visit wearing full PPE, and we know that might feel alarming, but our aim is to use the very best precautions to minimise risk to all parties, residents, facility teams, and the aged care GP team. And we know that being diligent about the PPE that we use will help achieve that. So that's number one, PPE. Number two, the GPs visiting facilities will modify the way they work and the way they visit according to the circumstances. So often you'll now notice that GPs may visit for less time in terms of general time in the facility, be very specific and see people as needed, and then do the remaining work remotely, such as note keeping, etc. And that is again to minimize risk and minimize exposure risks for all three parties: residents, facilities and facility teams, and the aged care GP team. And all of us have to get used to a new way of working that will continually change. So that's that part. The third part is that in these times when lockdowns are prevalent and facility lockdowns are prevalent, residents can be vulnerable to non-COVID illness and other deterioration because they're not receiving the same attention from family members or other parties. So we'll work with you, and our team will work with you in order to communicate to you the people we have identified that may be a bit more vulnerable and might need some more assistance than they would normally receive to replicate or to replace, well, not replace, but just try and replicate some of what the visiting family members, etc., would have been supplying. So those are the things from an aged care perspective. Now, from your perspective as a facility, there's probably 2 or 3 bits of advice that I'd like to give you. First of all, please remain and continue to remain vigilant with regards to COVID or potential COVID. What we know is that once it's entered a facility or anywhere where there are many people living together or in close proximity, it can spread quite quickly. And so preventing entry is a key strategy to minimize risk. And so continuing to be vigilant about that is going to be very important. Secondly, if you are having external visitors, then please continue to enforce social distancing within the facility, and also if there are people who are at higher risk of exposure, such as healthcare professionals, I strongly encourage you to encourage them to wear PPE to minimise risks of transmission into the facility or into residents. So that's that part. The third part is that you've done so well working with us with Telehealth. That's going to need to continue so that we can minimise exposure risks to all parties that I've talked about: facility team, residents, and visiting health professionals. So I just want to encourage you. We've all done lots of great work, yourselves, our team, in order to provide the telehealth in an efficient manner. Please don't let that go. Let's build on that so we can make the best use of the resources we have in order to still provide care in a safe environment in the new COVID world that we're currently living in. So that's a summary. The key messages here are that we all need to be ready to pivot and adapt. You will see our team members wearing PPE. Please don't be alarmed by that. It's all in the name of risk reduction, and the risk reduction is for residents, the facility team, your staff, and of course the health professionals themselves. So I'll stop there. I've been Sachin Patel. Thank you, and we'll be in touch soon with another update. Please take care and stay safe, and have a wonderful day whenever you're watching this. Bye-bye.